Hello, friends. Today we are going to discuss about BPC 145, Block 4, Areas of Applications of Counseling. And in this block, we are going to see Unit 14, Counseling for Special Population. So we are going to discuss about the special population, geriatric counseling, HIV/AIDS counseling, counseling in terminal illness, and counseling for psychological trauma. So today we are going to discuss about these four uh, special population counseling. So what you will learn after this listening this lecture, like you will be able to describe a special population, and you can understand the effect of aging, terminal illness, HIV/AIDS, and trauma on psychological well-being and common psychological problem in special population. So let us see the concept of special population. The special population is basically marginalized members. They are highly sensitive and susceptible to many hazards and prejudices. So what happens? There are lots of stigma, lots of insensitiveness is associated with this population. So this population is the most vulnerable part of the society. We all know that how elderly people are treated in some family or some society. Maltreatment is there. So regarding HIV/AIDS, no one wants to talk to them. People keep distance from them. So lots of stigma is associated with such thing. Uh, so we are going to understand this, how these things can be eradicated, or the special population can be benefited with the counseling. So first of all, we'll see the geriatric counseling. So, so in geriatric counseling is counseling provided to older persons or elderly. The word geriatric is a Greek word, and it's like started from the gerome, means the old man. And as per Indian law, the people who are 65 and above are called elderly people or senior citizen. The right word for this is senior citizen. So there are lots of concession is given, subsidies are given to this group. A total of 727 million such people across the world are above the age of 65, and nearly 104 million geriatric population in our country. So it means more than 10 crores people are having age more than 65, and they are vulnerable to physical and psychological problems. There are lots of reasons for that, because some of them become dependent on their children, and so once the person becomes dependent, there is a possibility of neglect and abuse. So psychological changes seen in older people is basically erection theory of human development. You all know that, like the late adulthood stage, ego integrity versus despair. So as ego and integrity, the person has achieved all the developmental milestones. So we have to, like, till 18, the developmental milestones are very fast achieved, and then slowly. So so at this stage, so basically the geriatric population is satisfied with the sense of fulfillment. So they think that they have done lots of things, they have done good job, saved money, married their children, and they are taking care of their grandchildren, and they have lots of plan, purchased house for their children. So that way they get a sense of fulfillment. But unfortunately, this doesn't happen with everyone. So there are some negative changes also occur, like decline in the memory. We all know that in old age, some of the geriatric population, they develop cognitive deficits. dementia-like of symptoms like poor attention concentration, forgetfulness, forgetting the weight. Okay, so if it is like in a normally also there is some amount of memory decline, and at this stage maximum of the older people they develop difficulty or problem in vision, hearing or walking. So specs is used, but sometimes uh, there are some hearing problems. So sometimes hearing aid may work, sometimes it may not work. So it depends upon the type of vision and hearing loss and the decreased independence. So as I told you, they become slowly dependent on the on others. So this decreased independence and the other psychological problems lower down their self-esteem. So they some of them they feel that they are not worth. Okay, so depression is also very common in geriatric population. Increased vulnerability of being marginalized, like they are given one room or one corner of the house, whole day they are lying on the bed. So because no one has time in the family to take care of such population, and there is a high possibility like the more dependence is basically leads to more physical and psychological abuse or at least neglect. So but there are like old age is like mm, it may benefit the younger population because this population is having lots of wisdom. They have gained experience throughout their life. So the younger population can take benefits of such experience and wisdom, and they will have more leisure time because they don't have to do much things. Most of them are retired and not able to do any other things. So they can like pursue their interest and passion due to like the responsibility of children and their engagement in their study and their children's marriage and other things. So they forget their hobbies and their passion and interest. So what they can do after retirement, they can fulfill all those interest and passion if they can. So they become grandparents and enjoy getting facilities and discounts, and also get care and respect from the family and the society. So, but like this is the ideal situation. A person uh, who has lots of wisdom and experience is heading the family as an advisor. So, like the family is managed by the son or a daughter, but this person is the work, work as an advisor. So lots of things can be taken as a benefit from these people. But what happens despite of giving them younger population should give them respect, they should take good care of them, but most of them are neglected. This is the fact. There are common disorders seen in this population. Some of them are very common, and how we can assess them. So there are lots of physical illnesses started like every 10 years, one illness is added. So at the age of 60 or 70, at least 5, 6, 7 types of illnesses might be having. So, as I told you, the person may have vision loss, hearing problem, body aches, osteoarthritis. So, it may have difficulty in walking and doing other things. Chronic COPD, diabetes, hypertension, heart problems. So, lots of physical illnesses may start developing. If the person is obese, then the development of such problem is fast and more problem may be developed. And there is also psychological disorders. They are also very common, like depression is very common in old age due to neglect, due to non-fulfillment of the basic needs or desire or interest, anxiety, paranoia. Some of the patient older aged people develop paranoia. Loneliness, this is also a very highly prevalent phenomena in older age, because they feel lonely even though they are in the house. They are living in a corner of the house. No one goes and talk to the person. If the person gives some advice or tells something, others will say, no, you just keep quiet, this is not your job. You just eat and sleep, take rest. So all these things may lead to loneliness, and loneliness basically sometimes it happens due to because after the marriage or the when the children they go to job, they leave the house, so no one is there, only two persons, husband wife. So it also called an empty nest syndrome, like when the birds they become able to fly, so they leave the nest. So same thing happens with this population. Dementia may develop. Dementia is a brain disease where the person's cognitive functions affected. So the person may forget things, forget place, forget his bed, forget that he has had breakfast or lunch. So he may demand again, or she may demand again. So all these things, Alzheimer's disease, okay, all these things may create this a lots of problem. So there must be some assessment done on this population. So and we know all that ki psychological assessment requires expertise. Means without training, without under supervision, you have done test, you cannot administer psychological test. If you administer, there will be lots of mistakes. Not easy to distinguish between normal changes and disorders due to aging. So, if you are not trained, if you use any tool and try to assess, you may find lots of problems. So, and you may not understand if these are the normal variations due to age, or it is it is disorders. So there are some tools in-depth clinical interviews, like it will give lots of information. There are structured clinical interviews. Structured means where the questions are already framed and you have to just ask. Semi-structured means there is a format of questions you have to ask, and the mm, client is going to give answers, and these questions are open-ended, means there is a freedom of answering in anywhere. And there are unstructured where there is no structured questions, you free flow of interview going on. There are other psychometric tests which are validated, standardized psychometric tests like questionnaires or scales or neuropsychological batteries. In clinical interviews, as I told you, like asking certain question in a predefined sequence. First, you have to ask this, then this, then this. And semi-structured interview, like some specified questions are asked during the assessment phase. Sequence is decided by the psychologist, and these questions are open-ended. Unstructured interview counselor decides the topic, themes, and questions to be asked. Open-ended questions are common. So, like in unstructured interview, you are not pre-decided what you are going to ask. Like the as the interview goes, it will be decided accordingly. Under psychometric tests, so like why we call them psychometric, because they are structured, they are reliable and valid tests. So reliability, validity is already tested, and they are used, and the results are more or less same. So for assessment of cognitive decline like memory loss, etc., and psychopathology, for example, depression, anxiety, or other problems like So like MMSC is mini mental state examination. It gives the idea about the how much decline is there. So it takes hardly 15 minutes to administer, and around 30 items are there. So but it needs lots of training before administering. The other questionnaire is very simple, but lots of training is required to administer this question. Then there is a dementia rating scale. There are questions which you have to ask and some client has to answer. There is a dash like depression, anxiety, and stress scale. And there are two versions, 42 items and 21 items. 21 item is more commonly used, and it is a very good test to find out the psychopathology. Then geriatric depression scale. This depression scale is especially meant for geriatric population. So there are other tools also which can be used, but this much tools must be used when you are assessing any geriatric population. Under neuropsychological assessment, like so what is neuropsychological assessment? So neuropsychological assessment are comprehensive and systematic assessment of functioning of the brain. So it aims at studying cognitive functions in relation to human behavior. And some aspect of neuropsychological assessment are attention, executive functions, memory, learning, information processing, problem solving, motor functions like ataxia, difficulty in walking, etc. So let me ask you one question. There is a test, radiological test called MRI, magnetic resonance imaging. So where if the MRI is done, everything will be known to the radiologist that which are the areas where problem is. Then why neuropsychological assessment are required? So this you have to understand that MRI basically see the structure of the brain, see the functions of the brain also, which function is more activated, which function is, which part of the brain is less activated. So it also does. But neuropsychological test tells correctly about the functioning of the brain. So sometimes on CT scan or MRI, there will be no difference, no changes. But when you assess neuropsych test, you may find the deficit. It means neuropsychological test, they assess the deficit first, then the machine. And in initial age, these tests are very useful. And the assessment of neuropsychological tests are also required to plan cognitive retraining. So if there is attention deficit, you can plan some task for attention improvement. If there is a memory deficit, you can plan some task for memory deficit, like way. So you will find the what are the functions are impaired, and accordingly you can plan intervention. So that's why neuropsychological assessments are still high in demand, despite having several types of radiological investigations, including X-ray, CT scan, MRI, PET scan, etc. So, how we generally diagnose? So, we take history, medical or psychiatric history is taken, developmental milestones are also taken, and psychosocial history must be taken. Then we interview could be structured, semi-structured or unstructured, and then we can use certain neuropsychological batteries. So one of the popular batteries is enhanced neuropsychological battery, or PGI battery for brain dysfunction, or we can use certain IQ measures, or there is a tool for geriatric population developed by ICMR, neurocognitive toolbox. So that can also be used, and so you can make the diagnosis on the basis of these three process. So is it clear? Now we have to see the what are the goals of counseling in geriatric population. So you have understood what is geriatric population, what are their concerns, and what type of assessment can be done. So after the assessment, you have to plan counseling. So what is the goal of this counseling? So behavior modifications in geriatrics, that is one of the goal. Enhancing coping skill to address dysfunctions due to old age. Ability to make decisions by improving cognitive functions and rebuilding their self-esteem. Improvement of the interpersonal relationship, enhancing motivational level. So sometimes they get discouraged. So all these things. So these are the goals should be kept in mind when you do counseling for geriatric population. So commonly used counseling techniques in geriatric population. So counseling are conducted basically in mainly two settings: individual counseling or group counseling. In geriatric population, if they are suppose they are staying in a old age home, or if you can gather them in a park or in a group, so group counseling is best for this population, because they will see, oh, there are others also, they are having same problem or suffering like this or having problems, so they are not alone. Lots of people are having same problem. Cognitive behavior therapy is also used, given by Aaron T. Beck. We have already discussed in our earlier classes. And so basically, it is management for the mild or moderate anxiety, depression, stress, or insomnia. And it gives emphasis on interrelationship among cognition, emotions, and behavior. Like cognitive therapy explains that cognition affect emotions and behavior, or emotions affect cognition and behavior, or behavior affects emotions and cognitions. And for example, if you get a thought that I'm not I'm not well, so it will lower your mood and you don't feel like doing anything. So same way, if you are lying whole day on the bed, you may get, you may not feel very good, very happy. So your mood will be low, and you may get negative thoughts like, "What is this life?" And there is no excitement in the life. So CBT also talks about assumptions, like automatic thoughts determine mood and behavior of the person, and they generally arise from dysfunctional beliefs. So in detail, I'm not going to discuss in detail because we have already discussed in our earlier classes. And like there's another therapy developed for treatment of dementia, reminiscence therapy. It includes recalling and re-experiencing of major events, like what happened in the past when the child was born, when the client has sent the child to school. All those things will be recalled, or some major event at least, to slow down the process of forgetting. So if you keep on recalling, so it will slow down the forgetting. Several techniques can be used, like storytelling, showing photographs, or stimulation of sensory organs with the help of external cues like touch, sound, and smell. So there are in some of the community, some volunteers, college students, they actually spare some time. For example, an hour they visit a home or in a park, and they interact with the geriatric population. And sometimes they visit home also, and they tell story. So these things will keep them alive. Another form of counseling is interpersonal counseling. It is intended to treat mood disorders such as depression. Main goal is to improve interpersonal relationship. Insight is developed about affected relationship and problematic thoughts. Helps in developing problem solving and communication skills. Gestalt therapy to create awareness about conflicts and ambiguities due to intra and extra environmental cues, and emphasis on living in present rather than digging out the past. Okay. So now we are going to discuss about the HIV/AIDS counseling. So what is HIV/AIDS? You might be knowing that it reduces immunity. So once the immunity is reduces, it opens a window for other types of opportunistic infections like tuberculosis, pneumonia, skin disease, any type of, which can be like viral or bacterial infections. So it is basically a cluster of disease, and 2.1 million seropositive people are there in our country. A steep rise in prevalence of AIDS in states like Andhra Pradesh and some other states. So in maximum states, the prevalence is decreasing, but in some of the states, the prevalence is increasing. So, do you know that there are some factors, common factors, which are responsible for the development of HIV/AIDS? So, the most important factor is unprotected sex. Like if you are doing sex with, having sex with another person, unknown persons, strangers, commercial sex workers, and you do not use condom, you do not use other protective measures, so there is a high possibility of developing HIV/AIDS. So if the person is having multiple partners, there is a high possibility of developing uh, HIV/AIDS. And if the sex is done with the same sex, so there is a high possibility of developing HIV. So protection is must. So, and if it like the maintaining of sexual contacts with various persons, so the possibility is there that you may develop HIV/AIDS. Illicit injectable drug use, like some of the people they use smack and opioids through injections. So, or they use painkiller injection like um, Fortwin, pentazocine. So they get high with this injection. So they use, sometimes they reuse those needle and syringes. Sometimes they share needle and syringes with others. So and repeated use of injections, yeah, mm, have possibility of developing uh, HIV, AIDS, and hepatitis. So transmission of virus during pregnancy or during breastfeeding. So these are the only ways of developing of HIV/AIDS. So if the person is always using safe sex, have only one partner, not multiple partners, and does not use in uh, injections for drugs, and if the mother is not positive at the time of pregnancy. So, impact on psychological health in HIV/AIDS. Psychological disorders like major depressive disorders, bipolar disorders, substance use disorders, suicidal ideation, and neuropsychological impairment are commonly seen in this population. Then low self-esteem, increased risk-taking behavior is also seen, affected psychological, psychosocial functioning, and reduced quality of relationship due to HIV/AIDS positive. So, what are the goals of counseling in HIV/AIDS? Improvement of psychosocial functioning. So the main goal is to improve their psychosocial functioning, to increase the efficiency of pharmacotherapy. Like they have to be on antiretroviral therapy. So if they are taking ART regularly, there is a high possibility that they may get cured. Their symptom may be under control. But if they are not regularly taking this therapy, then there is a high possibility that it may increase very fast. To reduce the impact of social stigma, to reduce frequency of dropouts, and to reduce further transmission by discussing about the safe sex. Commonly used counseling techniques in HIV/AIDS: client-initiated counseling, provider-initiated counseling, pre-test counseling, post-test counseling, and crisis intervention. Let us see a little bit in detail about these counseling. What is client-initiated counseling? Is basically when client initiate and seek the intervention for reducing emotional conflict and distress. Means when client come to you to be considered as a distress call, initial counseling session must be delivered on an immediate basis. So if you receive a call, so you have to do little bit counseling, or if the patient has first time come to you, you have to spend some time with the patient to understand his concern and then explain the things. Provider-initiated counseling is basically client is referred by physicians or any organization that he or she may be associated with. Recommendations are also made in the case of antenatal care, like when the lady is pregnant, and the prejudices and stigmas are reduced attached with the HIV testing in this counseling. So basically, counselor's job is to discuss about this. Then the most important counseling is pre-test counseling. So basically, counselor provides precise and up-to-date information about sexually transmitted infections, STIs. Okay. So then the information about the window period, like the person has unprotected sex. So if we go for testing, HIV testing, it may not found positive, though the infection may be there. So because there is a window period of 12 weeks. So the best thing is to go for after or at the re-investigation for after 12 weeks for HIV again. And early detection of IDUs, injectable drug users. So if you find any IDUs, so there is a high possibility that they may develop. So you warn them, you give them information. So there is a very interesting program for these IDUs, those who are using SMAC through injections or Godwin or pentazocine. So needle syringe exchange program is run in some countries, in our country also. Some of the NGO, what they do, their volunteers go to these IDUs, they take their old needle and syringe and give them new needle and syringe. For example, if they take 5 times in a day, so they give 5 needle and 5 syringe to them. And the next day they collect all these 5 and give new them. So it reduces the possibility of development of HIV/AIDS. And pre-test counseling is also important because the person may be very anxious if the report will be positive, then what will be done. So everything will be explained about the HIV to the client. In post-test counseling, basically you are relieving the positive status of the information to the client. So you are not supposed to say that, oh, your report is positive, you are having HIV. No. So you have to follow certain steps. So confidentiality you have to mention, and you have to discuss about the what does the client mean by the positive report. If HIV positive is there, then what he is going to do. So all these things, then you are slowly uh, disclosing this information, and you will tell that in see you are aware that you are positive, so now you are not going to have such a interaction or needle share with others because it may spread the infection. If you are having unprotected sex with others, it may spread the infection. Then learning healthy coping strategies will be taught to them. Knowledge of transmission, safe sex practices, psychosocial impacts of the disorder and future implication will be discussed, and abstain overloading with the information. So no need to tell lots of information, only like first you inquire and then you provide the basic information so the client should not develop anxiety or depression due to knowing this fact. Another counseling is crisis intervention. So basically, crisis intervention happens when the client came to know that he is having positive or he might develop HIV/AIDS. So this crisis intervention done immediately. So there are HIV counselors. They will do lots of work on this thing, and the short-term intervention plan to resolve emotional, physical, or psychological problems, and help seeking behavior is reinforced. So generally what happens when the client came to know that they are HIV positive, so they try to give the hope, so instilling the hope that still the world is alive, you can live, and there is if you remain, if you follow certain things, if you like develop healthy coping skills, so still you can enjoy your life. So such type of hope must be given by the counselor. So let us see the special scenarios in HIV/AIDS counseling. Counseling of children with HIV/AIDS. So they develop HIV/AIDS with their mother at the time of birth because mother was positive. So deciding their future goals, understanding the impacts of the disease, addressing stigma attached, transmission of HIV/AIDS, course of treatment, etc. This it reduces anxiety among them and develop a feeling of perceived support. Counseling of pregnant women to motivate pregnant women for HIV testing in their antenatal phases. Antenatal means uh, before pregnancy, uh, and the HIV seropositive pregnant women undergoing ART must be informed about its impact on growing fetus. So this much information should be given to the mother. So that's why there are certain like antenatal phases investigations are very important. So as soon as women get pregnant, some as some investigations like for HIV, for thalassemia, maybe are essential to be done. So to rule out if there is a possibility of developing this problem in children, so pregnancy can be terminated. Couple counseling, like if one couple is having HIV positive or both couple is having positive, so testing may lead to misunderstanding among partners. So what happens, one partner may go, another partner may not go for investigation, and physical abuse is common due to it, because if one partner is tested positive, so there is a high possibility that all these reactions will be towards the person who is having positive. And counseling helps in rebuilding trust in relationship. Premarital counseling addresses false notions about HIV/AIDS. So this counseling is very important. So you should read lots of material about the counseling. There are material developed by Ministry of Health, Social Justice and Empowerment, and NACO. Lots of material developed by NACO, National AIDS Control Organization. So you should go through all these material. They are available online also, and they have developed material for counselors, refresher course, counselors training, so you can go through all these things. So what are the common barriers in HIV counseling? Side effects of such medicine, ART, non-adherence to drug regimes. Non-adherence means not taking properly the medicines. Psychological reactions like anxiety, depression, and frustration. So you can imagine that the person who is depressed may not feel like taking medicine or getting well, and social stigma worsen the situation more. Now let us see the counseling in terminal illness. So do you know what is terminal illness? Like cancer. Okay, a disease which is responsible for reducing the lifespan of an individual who may live perhaps up to some months or even a few weeks. Psychological symptoms commonly seen are depression, higher level of anxiety, and even rage and frustration. So, the stages of grief in terminally ill patients. Kubler-Ross, she was working with the cancer patients, and then she found out these 5 stages. So these stages are called denial, anger, bargaining, depression, and acceptance. In an acronym, we call it DAVDA. So you will remember this DAVDA. So we all know that denial means denying the situation. uh, Anger means like the person say why it happens to me. I was so religious, I have not done anything wrong, why I had developed cancer. Bargaining means, oh God, please forgive me if I have done something wrong. I'll pray every day, I'll offer namaz every day 5 times. I'll go to temple every day in the morning. I'll keep fast. I'll visit Gurdwara like that. So I'll go to church every Friday, every morning. So like this, I'll attend each and every mass. So these come under bargaining. Ki anyhow, the person should get rid of from the illness. So then, after all these things, the person, there is a high chance of developing depression, because this is the fact that he has developed cancer or life-threatening illness, and ultimately the person accepts. But not everyone accepts. So all these 5 stages, if the person has to go through, and if the person accepts, then it helps in treatment of the illness. So, what are the goal of counseling terminally ill patients? So, focus on physical, psychosocial, emotional, spiritual, and practical needs. Because we all know that the person is not going to survive. The person is going to die after few years or few months. So, but till he has to live, he should live happily. Resolving conflicts and resentments, to provide knowledge about the disease and associated symptoms, to help the client in venting of their emotional fatigue and anger, to maintain quality of relationships. These are very important. Some people think, oh, now I have to die, so what to do? So no need to do anything. No. Still, the remaining months of the life can be enjoyed or can be tolerated well, without any despair, without any anger, without any depression. Common forms of counseling used in terminal illness. Grief counseling is very much used, problem focused counseling, supportive counseling, and existential counseling also, where the counselor discuss about the life and the past life, future life, punarjanam, etc. So let us see first brief and grief and bereavement counseling. So common types of grief in terminal ill clients are seen: normal, anticipatory, complicated, and disenfranchised. Let us see these things in little bit detail. So what is normal grief? So it is basically natural experience of the actual loss, which is accompanied by some emotional and physical reactions which may be reduced with time. Anticipatory grief. Nothing has happened, but the person may anticipate, like experience the loss before the actual one. For example, anticipation about the death when an individual is diagnosed with a terminal illness like cancer. So still there, because some of the cancer are curable, and the people will still live more than 10 years even after diagnosing the cancer. So, but as soon as the family members or the person knows that he has been diagnosed as he diagnosed cancer, so he thinks, now I am going to die. Another type of grief is complicated grief. This is a morbid form of grief. It becomes chronic, due to which the person develops some maladaptive coping style like substance use, suicidal tendencies, risk-taking behavior, etc. So this is called where, like, the person is depressed, person is having feeling of sorrow, at the same time due to poor coping skills or the chronic level of the grief, the person develops other problems. So it complicates the grief. Another type of grief is disenfranchised grief. So this is a hidden or latent grief which is not shown to other people. This is generally seen among cancer patients who do not want to disclose their illness to their loved one, or still they are depressed, but they will not say that they are feeling depressed. Their mood is low. They will not share such thing. So these are the four types of grief. See the problem focused counseling. So entire focus is laid upon current problems and techniques to solve them in an effective manner. It also helps in managing cognitive distortions and dysfunctional thoughts that may arise due to terminal illness. Another type of counseling is supportive expressive counseling. It is intended to deliver an emotional as well as social support to the client suffering from terminal illness. Counselor enables a person to tolerate various intrusive thoughts about dying. Common approaches to counseling in terminal illness. Psychodynamic approach to counseling. It intends to find a resolution of emotional conflict and defense mechanisms to build better insight about the root problems. Humanistic approach to counseling. As I told you, here the main focus is laid on the finding the purpose and meaning of life. So you discuss, you are not preaching the client that everyone has to die, so you have to also die. No. The main focus is to finding out the purpose and meaning of. So you are asking, as a counselor, you are asking the client, what is the purpose? What is the purpose of life or meaning of the life as per the client? What he understood, what he thinks, what is life, what happens after life. And all those things should be discussed with the client. Then expression of hidden fears, reaching up to self-actualization and develop an insight and better social relationship. So this is the counselor's job to teach the client, to help the client to express their hidden fear related to death or illness. So once the client starts expressing about the hidden fears of death, then it will be easy for the client to live the life, because once the client discuss about the death, the fear lessens, the fear reduces. So it will also help the client, the humanitarian approach, humanistic approach, help the client to reaching up to the self-actualization. So we all know that self-actualization, like first our basic needs, then at the top we understood ourselves, and then we must develop insight about the problem. We should not be in a denial mode. We should have understanding about the illness, about our life, about our relatives. We should all have all these things and better social relationship. Do not think that tomorrow or after few days or after few months I am to die. So there is no need to interact with anyone. No. Still, we do not know when one is going to die. Okay, but still, we keep on doing our daily chores of life, every day, daily activities, despite knowing that everyone is dying one or another day. So such type of tendency, like still some belief in God or supernatural power sometimes help the believers, those who were earlier believing in the God. So it will also be that okay, God is there, so there is no need to have any such problem. Behavioral approach to counseling is like behavioral techniques are useful for reducing the overall tension, fear, anxiety, or any distress. Relaxation exercise can be taught. Breathing exercise can be taught. Meditation can be taught. Behavioral counseling aims to help the client in gaining a perceived sense of control over his body and mind. So the person will be more in self-control. Family approach of counseling, like it targets hidden problems and dysfunctions role of the family members. Client and family members are encouraged to express their hidden feelings and develop a congruence among them. So sometimes family members they do not want to discuss about the death or the illness, so it creates lots of problems. So counselor help them to discuss all these things, so it helps them. Coming to the fourth and last part of the today's discussion, counseling for psychological trauma. So traumas are of two types: one physical trauma, like due to accident, or psychological trauma due to emotional breakdown, due to emotional uh, exploitation, emotional abuse, physical abuse, social, psychological abuse, sexual abuse. So all these things may lead to psychological trauma. So psychological trauma is referred to the unique individual experience in which the ability to integrate emotional experiences is highly affected by an event. The event is perceived as a threat to the life support system and psychological integrity of an individual. So generally it affects the integrity of the person. Let us see the types of psychological trauma. So acute trauma, a single stressful event like a natural disaster or an accident. Chronic trauma, an individual gets exposed to repetitive traumatic events for a certain perceived period of time, such as physical abuse or domestic violence. Complex trauma, an individual gets exposed to multiple traumatic events. The effect of these events is cumulative in nature, for example, severe chronic child abuse, or the like trauma faced by the Ukrainian people in Ukraine due to war, which is going on since a year. It will become almost a year, 10 months has already been on. So staying in such an environment is a very traumatic. Emotions in trauma act as a heavy luggage. In trauma, all these emotions are scattered around various corners of the mind. Packing this emotional luggage is not an easy job. However, when a person tries to pack this emotional luggage, many emotions don't fit in so easily. This mismanagement is a stressful task and causes a lot of frustration. This results in several flashbacks, images, and mood-related problems in the long term. What happened, for example, in case of rare? Those event will come as flashbacks, images like a movie, with any history of abuse will come like that. Almost 70% of adults experience some or other form of the trauma during their life. Only 20% of them develop PTSD or any other psychological disorders. It means maximum of us are having resilience to bounce back and recover from those effect of the bad event which happened with us, but around 20% of us fail. They need support, they need counseling. And why? Because they develop post-traumatic stress disorders or symptoms of PTSD or some other psychological disorders. For example, dysthymia. So let us see the goals of psychotherapy or counseling in trauma. Reducing impact of emotional overburden due to trauma, restoring levels of self-esteem for regaining psychosocial functionality, to help the client in developing better coping strategies, to reduce the impact of the flashes and stressful and intrusive memories on the psychological well-being. So these are the goal which counselor follow during the counseling of the trauma. Let us see the techniques used in psychological trauma. So one of the commonly used therapy is trauma-focused cognitive behavior therapy, then cognitive processing counseling, prolonged exposure therapy, imagery re-scripting, eye movement desensitization and reprocessing called EMDR, and emotional freedom technique EFT. Trauma focused behavioral therapy to change or modify emotional states and behavior. One needs to understand cognitive aspects in depth. It includes helping patients identify their dysfunctional thought patterns, providing another trajectory for the alternative thought, and rebuilding beliefs and self-esteem of the client. So, like this counseling is mainly focused on the trauma. Cognitive processing therapy is basically assumes that the client tries to understand traumatic events and develop distorted notions as a part of the aftermath of the trauma. Counseling helps the client in activating memory-based cognitive structures and identification of maladaptive beliefs. Prolonged exposure therapy, it assumes that the traumatic events are usually followed by their emotional processing. This includes two techniques, imaginal exposure and in vivo exposure. In vivo means in real situation. Imagery scripting. In this technique, clients, client is told to reimagine traumatic incidences by using his imagination. It emphasizes that the memories after the traumatic incidents are just like ghosts. Eye movement desensitization and reprocessing. This technique was given by Shapiro. The main goal of the counseling is to reduce physiological arousal and reformation of negative beliefs. It aims toward the reduction of distress level associated with traumatic episodes and incidental memories. Emotional freedom techniques EFT. So emotional freedom techniques was derived from thought field therapy. It is generally opted when there is a history of intrusive or unwanted touch. So all this therapy, the purpose of all this therapy counseling technique is to reduce the effect of trauma, to help the client to develop healthy coping and to get rid of such unwanted images or flashbacks. So let us sum up. So what we have discussed today, we have discussed about the concept of a special population, and in this we have discussed about the geriatric counseling. So we have discussed about what are the concerns of geriatric populations and what type of counseling can be done. And generally it is seen that the geriatric population is having uh, lots of cognitive deficits. So this can be like counselor can help to improve those functioning. HIV/AIDS counseling we have seen discussed, and in that we have discussed about the pre-test counseling and post-test counseling. Those are very important type of counseling. And we have discussed about the counseling in terminal illness, and there is a way to break the bad information to the family or the patient. So you are not supposed to say that, oh, your report says that